Hi, my name is Brad Rex, and I'm the President and CEO of eHome Counseling Group. Thank you so much for joining me today for COVID-19 and employee mental health, what employers need to know. I'm a former Disney executive. I actually ran Disney's Epcot theme park for 5 years. And one thing I learned there was that if you take care of your employees, they're going to take care of your customers. So the fact that you are here listening today on ways to help your employees improve their mental health is going to benefit your customers and your business. So let's get started on the journey to mental health care excellence. In today's webinar, we're going to cover a number of topics, including the value proposition for quality behavioral health care, the impact of COVID on your employees' mental health. We're going to talk about some barriers to providing high quality care, what your fellow employers are doing to try to overcome many of those barriers, some of the innovative approaches that are being taken to providing quality care to all of your employees and greater access. We're going to talk about some of the outcome measures. We're going to talk about specific programs for PTSD and addiction. I'm going to talk about how you can gauge the quality of your mental health care providers and what your insurance company does to provide quality care. And then finally, we're going to conclude with some specific tips and tricks for you personally to deal with the stress, the isolation, the anxiety of COVID, and now particularly as we go back into the workplace. So let's go ahead and get started. The value proposition for quality mental health care. 2 in 5 adult Americans have a mental health condition today. They're suffering from a mental health condition. Now, interestingly enough, prior to COVID, that was 1 in 5. It has now doubled because of COVID. If you just spend a little bit more money on mental health care, you get a huge payback. A 1% increase in mental health treatment, $2.4 billion in medical cost savings. And you need to look at your behavioral health and your medical costs together. Oftentimes they're looked at separately, but sometimes spending a little bit more on behavioral health will dramatically reduce your medical costs. To that point, 68%, more than 2/3 of behavioral health patients have a co-occurring medical condition. So what that means is someone who has diabetes and also has depression. Now, think about that for a minute. If the person has depression, they're less likely to check their blood sugar as often, less likely to take their insulin. And so they're more likely to have much more significant medical conditions because of that later on. In fact, what they found is 2 to 3 times higher medical costs than those without the co-occurring conditions. So basically, if you take care of their depression, you're going to dramatically reduce the medical costs for that person that has diabetes. 14.8 million with an alcohol use disorder, 2.1 million with an opioid use disorder. By the way, these are pre-COVID numbers. So post-COVID, we expect they've gone up dramatically. And you may think, well, the person who's struggling with addiction, a substance use disorder, is that homeless person on the street. And yes, you're absolutely right. That's oftentimes what happens. Someone has an addiction issue and they essentially end up homeless. However, 70% of people with a substance use disorder actually maintain employment. So these are your employees that are struggling with this. And when they do, their healthcare costs are much higher, 2 times higher for someone with alcohol use disorder. They're more likely to be involved in workplace accidents, file workers' comp claims. But the good news is that if you get care, if you provide care for folks, you can dramatically reduce your costs. So someone with opioid use disorder who gets care costs $13,000. If they don't get care, it's $31,000. And primarily, if you think about it, that's emergency room visits, it's deterioration in their physical health because of the addiction, which increases their medical care costs. So there's a huge value proposition for employers to spend the money to get quality mental health care. Let's talk about the COVID-19 impact on employee mental health. As we'll discuss later, eHome Counseling does assessments on every single client who comes into our care. And those assessments measure the things you see here on the screen. And so we had a large database prior to COVID. We looked at March through June of 2019, compared it to March through June of 2020. And these were the increases we saw. 33% increase in depression, which was already our highest condition that we saw at 57%. So now we're approaching 80% of people with depression. Anxiety, 27% increase. PTSD, huge increase in PTSD. You have to realize that COVID-19 has been a traumatic event for our society, for our individuals, for your employees. And because of that trauma, because of losing loved ones, getting sick, not being able to be with someone when they died in the hospital, not being able to have a funeral for them afterwards, loss of jobs, I mean, all different things. We've seen a huge increase in PTSD, particularly in young people that we'll discuss later. Drug use up 39%. We'll talk about that more. Alcohol, suicide. So you have probably felt it yourself, but even if you haven't individually felt it, your employees have absolutely felt this, and we've seen these huge increases. Let's talk about overdose deaths. The CDC has reported 28.8% increase in overdose deaths. Now realize, prior to COVID, we had the opioid epidemic, and we had these deaths from opioid use. It has gotten substantially worse. And the one thing the CDC says is that number is understated, because they know there are cases that they haven't included in this data that will come through later on. But, you know, you can just see, I mean, it's incredible. And once we see in the news a reduction in the coverage for COVID cases and COVID deaths, you're going to see an increase in coverage of the overdose deaths, because it is so dramatic and impacts so many people. So let's talk about some barriers to quality mental health care. Dr. Doug Nemesek is the medical director for Cigna Psychiatrists. He said behavioral care is 10 to 20 years behind medical care in terms of access metrics and evidence-based treatment. Now, Cigna is a major leader in telebehavioral health, so they have helped to recover some of that lost ground through the programs that they're doing. But when you really look at it, you've got a situation where there's limited access. 51%, more than half the counties in the US, have no or extremely limited mental health care resources. That's psychiatrists, psychologists, counselors. And so somebody has to drive 2 to 3 hours to go to a counseling appointment. That's just not going to happen, and they're not going to get the care that they need. Stigma, confidentiality. There's still a stigma around mental health care. Now, fortunately, young people are changing that, and we're seeing a lot of young people who actually are very smart saying, hey, if I get mental health care, it's going to improve the quality of my life, and it's going to be very important for myself and my loved ones. But in some of the older generations, you still see a lot of that stigma out there. Fragmented providers with no quality measures. One of the things that really surprised me when I got into this 5 years ago is that there are not typically metrics that are done. So how do you know what your condition is and if you're getting better? And that's pretty consistent across this industry. Shortage of behavioral health doctors and counselors. Prior to COVID, we had a significant shortage, particularly in psychologists, psychiatrists, and now with COVID and the increased demand, that has just become much, much worse. Cigna did a wonderful paper. It's the Cigna study on the 1-year impact of COVID on telebehavioral health, and I highly encourage you to download it. But these are some of the findings. A 27% increase in behavioral health outpatient care compared to pre-pandemic levels. So in line with the data that I showed you of the increases due to COVID, they're actually seeing this in utilization of services. 63% female versus 48% pre-COVID. So I would submit COVID has had a disproportionate impact on women. Oftentimes it falls to the women to do the homeschooling, to take care of elderly parents who may be struggling, to keep the home front together. And we're seeing that absolutely in mental health conditions for that population. The other groups I mentioned is the younger crowd, but the good news is that they're actually seeking help. So 45% of those seeking behavioral care were under 30. So number one, less stigma, more willing to reach out. But number two, impacted more by COVID and needing that help. I know many of you on this webinar are human resource professionals. You may be executive leaders of your teams responsible for your health plan selection. And so what you see here is that companies have seen this, and particularly the HR professionals. 44% of HR decision makers, 27% of health plan leaders stated the importance of increased access to mental health services for their people. Now, some good news here, half of the people who are doing telebehavioral health reported higher productivity at work and reported taking fewer sick days. So it really does help, and your folks are going to be better off getting the care that they need. And then interestingly, 66% of all office visit behavioral health claims were done virtually. Now, with telehealth, we saw a dramatic increase in telemedicine utilization at the beginning of the pandemic. That has dropped off significantly, though, as people have been able to go back into their doctor's offices. But with telebehavioral health, we've actually seen it stay completely consistent. And people have found it so much more convenient, accessible, confidential. They're sticking with virtual behavioral care, and we're seeing that in the claims data. So Eva Borden, Managing Director for Behavioral Health, said that from Cigna's point of view, they're following a multifaceted approach. So it's not go to an in-person counselor. It's virtual care, video, engage digitally, apps, text therapy, other forms, but ways that you can reach people very accessibly and confidentially and give them the care they need in the format that they want it. So what are your fellow employers doing about this? Well, employers' key concerns are high quality, and I want to emphasize that, high quality mental health resources or services and substance abuse treatment. Telebehavioral health services, frankly, if you aren't offering telebehavioral health, you're behind the curve. Most of the quality companies out there are doing that today. Access to online mental health support resources, 88%. Up from 69%. So once again, if you're not offering your employees apps, videos, articles, that's something you need to get to work on. Training managers, this is interesting, you know, about 2/3 of the companies are training managers in how to identify employees that have a mental health issue and get them the help they need. So the old model of disciplining or firing people because they have a mental health condition is not there. It's let's figure it out. Let's keep these valued employees, get them the care that they need. More than half of the employers are going to lower or waive employee costs to get virtual behavioral care. And so we talked before about barriers. Well, one barrier for many employees is, hey, I've got to reach my deductible, I've got to pay my copay, and that gets to be pretty expensive. And so we're actually seeing more than half the employers understanding the value proposition, right, of behavioral health. They're waiving that so that the employees can get the help that they need. Big issue, availability of mental health providers. You know, 1 in 5 report being very satisfied. So that means 80% are not satisfied with the availability. And this is very important. How quickly can your employees get in to see a counselor and get the help they need? And then finally, just as we saw on the medical side, where Cleveland Clinic, Mayo Clinic, others were providing medical care and being considered a high-performing network, we're now seeing companies looking for the same in their behavioral health and looking for the companies that can have guaranteed performance in helping their people. I frequently get the question, hey, Brad, you know, we've got EAP. We don't need anything else besides that, right? Well, actually you do. And I would submit that EAP can often be a barrier to your people getting quality care. In most EAP programs, you see 1 to 2% utilization. Well, the American Psychological Association says you have to have at least greater than 5% utilization for the program to be effective. And remember what I said earlier, 40% of adult Americans have a mental health condition. So if your EAP is only reaching 1 to 2%, you can see that they aren't providing the care that your people need. Many EAP programs are phone or text counseling. The gold standard is face-to-face video or in person. Variable counselor quality, I can tell you as a provider, EAP programs reimburse at a very low rate. And so the quality of the counselors they get is often not very high. And in particular, in this market today, where counselors are in such demand, many of them have dropped EAP programs completely. Random counselor matching, you basically get whatever the next counselor on the list is. Whereas you want to go with a quality company that's going to match that client to a counselor to meet their needs. Session lengths are anywhere from 15 to 30 minutes. The gold standard, again, full 1 hour sessions. At the end of your EAP sessions, you end up, at the end of your EAP sessions, you often end up handed off to a different counselor. Well, now the client has to start all over again. Whereas with quality programs, you have the same counselor throughout, you have the continuity of care. EAP programs typically can only handle mild conditions, mild anxiety, mild depression. What happens when someone has more severe conditions, co-occurring conditions, PTSD, addiction, for example? No outcome metrics. You ask your EAP provider and say, well, tell me the condition of people who came into the program, tell me their condition after they met with you, and they'll look at you with deer in the headlight eyes. What they typically will say is, well, here is the utilization rate, this is how many sessions we did, which is not an outcomes-based metric. And then finally, EAP programs really don't impact healthcare costs. They don't reduce them, whereas quality programs do. So this new approach to behavioral healthcare, you can see I have this picture of the person lying on the couch. That doesn't typically happen anymore. You typically see it in a chair. And yet, if you really think about it, and particularly prior to COVID, we hadn't changed the behavioral health industry since the days of Freud, right? I mean, Freud's patients would travel to his office, meet with him in his office, have their session, leave. And now today we can do it in so many different ways and so many, I would submit, better ways. So you have virtual counseling delivery, you have diagnostic assessments, individual and group counseling, family sessions, all done virtually, by the way. Specialist counselors, medication-assisted treatment, the therapy apps, online education, accountability apps, text check-ins. So just as Signa said, this multifaceted approach, this is the new approach to behavioral health care. I'm just going to take a minute and talk a little bit about eHome. As I said, I've been doing this for 5 years now. And when my partner and I founded eHome Counseling Group, we really wanted to take a completely different approach to behavioral health care. So from the very outset, all of our counseling has been delivered virtually. So this was pre-COVID, long time before COVID, everything virtually, face-to-face video via laptop, tablet, or smartphone. Metrics-based care, we'll talk more about this, but as I said, every person assessed for multiple conditions, quantitatively measured, and then remeasured as they go through. The highest quality counselors. As a Disney person, I knew that the quality of the counselors would determine the quality of our outcomes. And this has been proven in multiple studies. The A-level counselors get the best outcomes in the shortest period of time. So we have a very rigorous process for selecting our counselors to get the A players. One of the best comments we received from one of our clients was, I got more in my 12 sessions with my eHome counselor than I did in 14 years of therapy. And that's what happens when you have great counselor matched with a client, and you match that client with the counselor effectively, and then the counselor develops a strong therapeutic alliance with that person. It generates trust, the person opens up, and they get better. And we have a fabulous client care team, a world-class client care team that individually talks with each client and matches them with a counselor. Because that's another big barrier for many people. Hey, how do I find a counselor for me that's going to work for me? And we take care of that with our client care team. Individual clinical treatment and programs, multifaceted defined length programs that we're going to talk about, integrated HIPAA compliant platform. When COVID hit, the government allowed counselors to use unsecure platforms like FaceTime and Skype. But from day one, 5 years ago, we said, we want the most secure communication between the counselor and the client so that the client can feel very comfortable that what they're sharing is going to stay completely confidential. We're going to talk about proven effectiveness. Our no-show rates are less than 3%. Now, traditional in-office counseling is 25 to 40+%. And that's because of having to travel there and all the rest. In our case, we keep people engaged. We do it virtually. The metrics-based treatment works, and then the quality of the counselors. I'm a Disney executive, so of course I'm going to be focused on customer satisfaction. Very proud to say we have a 4.6 out of 5-star rating. And our programs are actually much less in cost, particularly for treatment of addiction and PTSD than other alternatives out there. So the power of video counseling as a delivery method. Again, COVID has proven this out time and time again, but even prior to COVID, what we saw was faster appointments, reduction in hospitalization rate, decrease in missed appointments. And this one in particular, I'd like to highlight. Think about a 25% reduction in hospitalization rate, lengths of stay, and services. I mean, that's amazing. How much would that reduce your medical costs? And that's what Optum saw for their telebehavioral health clients, a dramatic reduction in these different medical services. Metrics-based treatment. One of the things that really shocked me when I became involved in the behavioral health industry is the fact that they were not using metrics. That typically you would go, you meet with the counselor would say, it appears you have depression and this is what we're going to do. And you have very high quality metrics available out there. When you use them, you have a 3 times remission rate, 74% versus 29%. And so quality providers use metrics. In our case, we use the M3 assessment, 27 questions completed online in 5 minutes, and it gives you a quantitative measurement of anxiety, depression, bipolar disorder, PTSD, substance use disorder, suicidal ideation. So it doesn't just say you have depression, it says you have depression at the 85% level. You have PTSD at the 65% level. And so when you get that, and we do that before the first session, so the counselor has that and they can zero in on what's going on with that person. They ask follow-up questions, they validate the results, they can do the diagnosis, do the treatment plan, all in the very first session. And then we reassess the person, typically about 4 weeks or 6 sessions in, and we redo the assessment as the person continues through treatment, so they can actually see that they're getting better, and we can see that they're getting better. And then once they've reached a normal level, they can be discharged. Because that's another big question people say is, well, hey, how do I know when I'm done? Am I signing on to have therapy forever? And in our case, we can actually say the metrics show and that you're ready to exit treatment. We can also analyze these assessments. So we gave our assessment database to a professor of health informatics and said, what can you determine from this? And so she found, interestingly enough, 22% of the people really didn't have a mental health condition. And so what they were dealing with might be daily stress, and there are things that we can do to help them with that, but they were very relieved that they really didn't have a condition. However, in 50% of the cases, it was moderate or severe. And as you might imagine, these are pre-COVID numbers. Depression was our highest at 57, anxiety 44, PTSD 40, bipolar 13. These numbers have gone up dramatically since COVID. So when you do these assessments and you figure out the person may have a more severe condition, you can actually match the offerings that you give them to their condition. So if they have mild to moderate anxiety, depression, no co-occurring conditions, individual sessions may be perfect for them. But as you get into more significant conditions like PTSD or substance use, then we add in additional things like online education apps, text check-ins, family sessions, medication-assisted treatment. So you can really tailor the care to the level of the person's severity and mental health condition. The other nice thing when you use assessments is you can actually monitor improvement, and you can actually determine, is what we're doing effective? And so we had that same professor look at clients who had a minimum of 4 sessions and said, have they improved? And amazingly enough, and we were actually shocked by these numbers, when you look at it, 88% improved for depression, 86% for anxiety, 93% bipolar. So you ask yourself, well, does virtual counseling work? Does metrics-based care make a difference? Are e-home counselors any good? We can actually see it in the assessment results. And it's not just do the person improve, but you see, 58% improved by 75% or more. In the drug use, 80% by 75% or more. So it is absolutely effective. And what we can do is say, okay, for your employee base, you send us this number of employees, we can do on a de-identified basis, here was their condition when they came in, here was their condition after treatment. And so we can actually prove the value of the care that was given. Let's talk about substance use disorder. Again, when I first joined the industry 5 years ago, we had a meeting with an addiction treatment center. And so I said, well, tell me a little bit about your program. They said, well, it's $30,000 for 30 days. I said, whoa, $1,000 a day, that's pretty expensive. I said, but once you're done, at least you're cured. And there was polite laughter in the room, bit of a pause. And they said, well, no, actually, we see the same people 4, 6, 8, 10, 12 times. And I thought, oh my gosh, $30,000 a month, and you're doing this 10 times? It's no wonder people get bankrupted by this, families trying to take care of their kids. There's got to be a better way. The problem you have with traditional care is the person goes inpatient. They get detoxed, they have 24/7 care, they've got doctors, counselors, no stress, no work stress, no temptation, there are no drugs there, no family stress. I mean, many of the issues that cause their original addiction, they're not being faced with. And so they get discharged, and now all of a sudden they're going back to their old environment. So now they've got the family stress, the work stress, they've got the drug dealer calling them up and offering them drugs again. And this is what happens and where they relapse. So 50 to 80% of the people relapse typically within the first month. And today, where you've got fentanyl-laced heroin, that's what causes people to overdose and die. Now, prior to fentanyl being introduced into the illegal drug chain, people would overdose on heroin, but oftentimes it wouldn't be enough to kill them. Today it is. And that's why you're seeing this dramatic increase in overdose deaths, and particularly since COVID. We believe in a different approach. In order to get long-term sobriety, you have to have healing of the brain. Drugs actually change the brain chemistry. And so you have to change that back to normal mode. And the way you do that is through medication for addiction treatment. Highly effective drug called buprenorphine that is given either daily or a monthly injection that increases the addiction survival rate by over 50%. So let me repeat that again. Increases the addiction survival rate by over 50%. Now, think about it for a minute. If there were a cancer drug that increased the survival rate by 10%, everybody would take it. And yet, in addiction treatment programs today, only 29% of addiction treatment programs offer medication for addiction treatment. We believe every person who is struggling with addiction needs to be on medication. It prevents withdrawals, it prevents cravings, and it allows time for the brain to physically heal. In addition, though, if you want long-term sobriety, you need emotional sobriety, and that comes from virtual behavioral care. What they have found is treatment completion rates are 2 times better for video treatment compared to in-person, 80% versus 41%. And, that really just makes sense. I mean, a person who is struggling with substance use disorder is going to come up with any excuse not to do their in-person sessions, right? I don't have clean clothes. I didn't take a shower. I don't have transportation. When that session takes place on their cell phone, all they need is a charged cell phone. And so it's much more likely they're going to complete care. Hazelton Betty Ford, of course, is a world leader in addiction treatment. And when COVID hit, they had a situation where they had people in residential care. They had some people who did residential care and then shifted to virtual care. Then they had others who had completely virtual care for their addiction. They published research that showed that the people who had completely virtual care actually had better outcomes and were more likely to stay in treatment than the other 2 categories. So this was landmark research, and it really shows the value of virtual care. And remember, when people are getting their care virtually, they don't have to go away to a treatment facility for a month. They don't have to miss work. They can do their sessions completely confidentially at home or in their office. And so they're much more likely to get care, and hopefully earlier on. But then you match this virtual care and medication with an app for education accountability. So our program includes an app called Tether, and it gives a daily inspirational, motivational, educational video. It has different exercises that you do. And so it provides that 24/7 support in between sessions. Now, we don't believe an app can ever take the place of a human counselor, but we do believe it can provide support in between those counseling sessions and basically reinforce you getting your MAT and your virtual behavioral care. Our program is 6 months long. We think that's very important. It takes 6 months for your brain to heal, for you to work through a lot of the issues, a minimum of 6 months. It costs less than 1 inpatient stay for 6 months of care. So when I talked earlier about 50 to 90% less in cost, dramatically lower cost than inpatient care. As I said, all the benefits of confidentiality, convenience, the ability to stay working. And then our relapse rate in 6 months is less than 10% compared to the current treatment, which is more than 50%. So there are great alternatives out there today for addiction treatment, and you should be sharing these with your employees to help them. Let's talk about PTSD for a minute. Many people think, well, PTSD is a veteran issue. And it has been very well publicized for veterans. It is a real issue. 20% of veterans, Iraq, Afghanistan veterans, evidence PTSD. But it is much, much broader than that. We have firefighters, police officers, healthcare professionals. Healthcare professionals in particular during COVID have been exposed to incredible trauma and have developed PTSD. So, you think about some of those folks who had to make terrible choices of who lives, who dies. They had to be there when patients were dying, couldn't have family members there. I mean, many medical professionals were very concerned about their family members catching COVID. And in some instances that actually happened and family members died. So now think about that kind of stress. So huge there. Corrections officers, 20%. And this is the most astounding. In a CDC report published back in August, 32%, about 1/3 of our 18 to 30-year-olds are evidencing PTSD. So this is a major societal issue. It's a notch below the substance use disorder, but still very prevalent. And PTSD, from an employer standpoint, causes employees to have more sick days, misproductivity, they can't sleep, hypervigilance, avoidance syndrome, all kinds of issues. that if you help take care of, you're going to get a much more effective and productive employee. Well, the problem with PTSD is that there hasn't in the past been very good care options. It's typically been residential care, $30,000 to $50,000, 2 to 3 weeks. You have to go away to do it. Once again, confidentiality is a big issue for people. Our program is virtual care, completely virtual. You can do it completely privately, confidentially, less than $5,000 for 12 weeks of care, and highly effective. We are a major partner with Wounded Warrior Project. We were just named as the best online therapy for veterans, and a big part of what we do is PTSD treatment with this population. You saw some of our results previously. So I would just encourage you to be looking for this in your employees and then having them come to us. We can help them. McKinsey did a fabulous report, The Mental Health in the Workplace, The Coming Revolution, and it had 6 ways to ensure that mental health benefits serve a company and its people. So this is some very practical things you can take back to your company. First one, I know I've beaten this one to death to a certain extent, but measure behavioral health. Measure, measure, measure. You don't have any idea if it's effective if you aren't measuring it. And so whatever provider you use should be providing you metrics, and not just how many sessions or what the cost. It should be, here was the condition when people came into our care, here was their condition when they came out. Make behavioral health a transparent priority. Let's get rid of the stigma, let's get rid of the barriers and say, we're going to get the care people need. We know 40% need care, let's go and get that for them. Hold the leaders accountable. I mentioned before, training for managers and helping them to identify the people who have an issue and then getting them the care that they need. Exploring a range of new services, including online interventions, following on with what Signa talked about, what I shared with you, multifaceted approach. And so if you're not doing that, as I say, that's something you really need to engage with, because that's what people are expecting today. Work closely with your health benefits administrator to ensure adequate behavioral health coverage. We obviously are starting in the season where you're starting to look at your health plan again for 2022. And this is a perfect time to ask some very pointed questions when it comes to behavioral health of your insurance carrier or your providers. I'm going to provide those questions to you so you can ask them, but this is when you need to make sure that the quality of the care you're getting is what you're paying for. And then finally, consider on-site mental health services as we start in particular to go back into the offices and everything. This does not have to be a mental health counselor. It can be a navigator. It can be a person who helps identify this for your employees and then gets them the help that they need. Because frankly, given the shortage of counselors and the challenges, it will be much easier for you to find a navigator than it will be to find a mental health counselor to be on site all the time. Harvard Business Review noted that $4 is returned to the economy for every dollar spent caring for people with mental health issues. So if that's not a good ROI, I don't know what is. Desired components of a quality behavioral health program. I would encourage you to download this employer guide to identifying high-value telebehavioral health care. It's produced by the Florida Alliance for Healthcare Value and is available online. It will give you specific questions, specific things to look for when you're trying to gauge the quality of your behavioral health care program. So just a few of the things up on there. As I said before, your carrier should be looking at minimizing both medical and mental health costs. In some instances, what we see is they've got part of the companies focused on medical, part focused on behavioral health, part focused on pharmacy, and everybody's trying to reduce their individual costs and not looking at the big picture. So they should be able to look at all three at once. Telebehavioral health by video with quality providers. Once again, if it's like, oh, we do text, we do phone, that's not going to give you the same quality as face-to-face video. Short time to appointment, that's all about access. How long does it take an employee to get a session with a counselor? And it varies dramatically across carriers. measurement-based care, removal of barriers, particularly for addiction treatment. Some companies, insurance companies, have put a lot of barriers in place to prevent people from getting addiction treatment. And you have to remove those barriers because the value of people getting care is worth so much more than the cost. Promotion of MAT. Key question you should ask is, how many of the people that are being treated for addiction are on medication for addiction treatment? And it should be a pretty high number. Coordinated primary and behavioral care with behavioral care screenings. Unfortunately, only about 10% of primary care physicians do behavioral health screenings. That should be 90%. But you should look for providers, carriers who demand behavioral health screenings in addition to physical health screenings. And then, just like any company, high customer satisfaction, low no-show, and high completion rates. Okay, you guys have been amazing. We're coming to the end here. And so I want to share with you 10 tips for you to combat stress and isolation, particularly as we are in this COVID time and hopefully starting to exit out of it. Now that we're finally traveling again, we get to hear the airplane safety spiel where they say, put the oxygen mask on yourself first before helping others. And that's the key thing I would tell you. Take care of your own mental health first, because when you do that, you're helping your fellow team members and you're becoming much more productive yourself, and you're setting a great example for others. So if you're struggling with a mental health condition, make sure you get care as well. But some of these things, stay connected with your social networks. Now is a good time, to start reaching back out, hopefully meeting back in person. That'll help reduce your stress, and you'll see you're not in this alone. Maintain your personal routines. In many cases, people during the pandemic actually improve their routines. They started to exercise more, maybe they got more sleep, and so continue that as we go through. Stick with credible sources of medical information. Facebook is not a credible source of medical information, okay? The CDC is, Mayo Clinic, WebMD, some of these others, but please don't just use information that you find on the web that doesn't come from a good source. This next one is really talking about helping others. And in particular, as you help others, you're going to find that you benefit as well. So helping in volunteer, maybe in a food bank, a homeless shelter, even just reaching out to people who are in need, you can help yourself by doing that a lot. Do things that are pleasurable to you, but don't self-medicate. So do not, use tobacco, alcohol, other drugs to self-medicate during this time, but do things that you enjoy doing. So if it's watching a movie, reading a book, whatever it is, be nice to yourself. Practice accepting uncertainty and anxiety as a part of human existence. So we've gone through a dramatically uncertain, challenging year. I heard one speaker say, we've gone through a decade of change in a year. And we need to realize that, and realize that that's a part of life, and not basically try to bury it or ignore it, but accept it and work on it. Remind yourself of human resilience. We have gotten through this far. We've gotten through other things. We got through 9/11. Previous generations got through the Spanish flu. So we are going to get through this, and we'll be better on the other side. Spend time in nature, particularly walking, running, or some other physical activity. I'm a runner, and I love being out in the mornings, having the sun rising, seeing the trees, the birds, the animals. It's just great for me to reduce that stress and just see that I'm part of a much bigger picture out there. And then consider yoga, meditation, controlled breathing, or spiritual practices like prayer. Once again, many people during the pandemic started doing meditation and other things to help, and I just encourage you to continue that. But my number one message is, don't hesitate to seek getting professional help if you need it. Mental illness is the same as physical illness from the standpoint that the earlier it's caught and treated, the better the outcome in a shorter period of time. So just like it's a lot easier to treat stage 1 cancer than stage 4, it's a lot easier to treat mild depression than it is to treat severe addiction. Questions, we have had questions in chat and we'll continue to have those. But in particular, if you have questions that don't get answered through this, or after the webinar you come back and say, oh, I wish I had asked that, then please feel free to reach out to me. You can see my email on the screen. You can visit our website at www.ehomegroup.com. But we are here to help. We want to help you. We want to help your employees to have just the finest in virtual mental health care. So thank you so much for your time today during this webinar, and I hope this information has helped you on your journey to behavioral healthcare excellence. I really commend you for being here, and particularly commend you for caring for your employees. When you think about it, when you help an employee who is struggling with their mental health care, you're not only benefiting them, you're benefiting all their loved ones, their families, and their children for generations to come. So thank you and have a great day. Bye-bye.